Hello everyone, we're back again today to talk about the beta blocker class of medication. Beta blockers are used to treat various conditions and we'll explore their mechanisms of action, indications and their potential side effects. Let's get started. There are different indications for beta blockers, for instance hypertension, heart failure, tachycardia, meaning the heart is beating too fast. They can also be beneficial in migraine prophylaxis and managing anxiety. The mode of action of beta blockers involves antagonizing the effect of epinephrine, also known as adrenaline, on the beta receptors. There are two types of beta receptor targeted by these medications. Beta 1 receptors, primarily located in the heart, that regulate the heart rate. By antagonizing these receptors, beta blockers reduce heart rate by impacting the SA node activity, AV nodal conduction, and the heart contractility. Beta 2 receptors are present in vascular and bronchial smooth muscles, and blocking these receptors can lead to bronchoconstriction and peripheral vasoconstriction. Certain beta blockers also block alpha receptors, resulting in vasodilatory effects that help lower the blood pressure. Beta blockers can be divided into two classes, selective and non-selective. Cardioselective beta blockers target beta 1 receptors and are usually indicated for tachycardia or heart failure. An example of these is bisoprolol, atenolol, and metoprolol. Cardioselective with alpha blocking effects combine cardiovascular selectivity with vasodilatory effects, such as nebivolol and acebutolol. Non-cardioselective beta blockers target both beta 1 and beta 2 receptors, which can cause vasodilation and reduce blood pressure. These include pindolol, propanolol, sotalol, and timolol. Another way to remember these is that most of the non-selective ones start with the letter near the end of the alphabet, with the exception of carvedilol. Non-cardioselective ones with alpha blocking properties, like carvedilol and labetalol, produce vasodilation through alpha receptor blockade. And non-selective beta blockers are more likely to cause bronchoconstriction. Some beta blockers are lipid soluble, like propanolol and metoprolol. They can cross the blood-brain barrier, making them suitable for indications such as migraine prophylaxis and anxiety. On the other hand, water-soluble beta blockers have longer half-lives. And a small way to remember the water-soluble beta blockers is using water cans. Celiprolol, atenolol, nadolol, and sotalol. Contraindications include bradycardia, which is a low heart rate, and cardiogenic shock. For example, myocardial infarction, a heart attack, with a reduced blood pressure and pulmonary edema, fluids in the lungs. The side effects of beta blockers are that they can mask hypoglycemia symptoms, low blood sugar levels, because the symptoms of low blood sugar levels would be tachycardia, a fast heart rate, and tremors. Beta blockers can also increase insulin resistance and lead to peripheral vasoconstriction, often causing cold fingertips. When prescribing beta blockers, it's crucial to monitor the patient's pulse and their blood pressure regularly to ensure their well-being. Now we have a sample exam question for you. What drug combination can cause heart failure, bradycardia, and even asystole? Is it A, beta blockers and non-dihydropyridine calcium channel blockers? B, beta blockers and dihydropyridine calcium channel blockers? C, beta blockers and ACE inhibitors? Or D, beta blockers and direct renin inhibitors? The answer is A, and this is because this combination can cause cardiodepression, and it's always important to have this combination of classes reviewed by the doctor or a specialist. And there you have it, an overview of beta blockers, their mechanisms and indications, and their considerations. These medications play a significant role in managing various cardiovascular conditions, and as future pharmacists it is vital to understand their nuances. Thank you for watching. Please don't forget to share, like and subscribe to our channel, and we'll see you in the next one.